Hi, everyone. Today we have another co-author spotlight of the book, How Healers Heal. We have Dr. Kelley Hagerich. Hi, Dr. Kelley.
Hi there. Nice to be here today. Thank you for having me.
Thank you for being a part of this incredible book. I'm so excited for you to share your story, although I don't want you to give away your story in this interview, and for everyone to learn more about lifestyle medicine through your journey. So let's get started. Tell us a little bit about yourself.
Sure. Well, I'm originally from a small town in Pennsylvania and did my schooling on the East Coast and then made my way out to beautiful California, where I currently work for the Veterans Hospital in Palo Alto. I am practicing obesity medicine and lifestyle medicine via telemedicine. It's a new venture for the program, and so far it's been a wonderful, rewarding experience.
Amazing. I mean, your story in the book is so good, but there's a few doctors you working in the VA system and doing what you're doing, which is amazing. But tell us how you got introduced to lifestyle medicine in the beginning.
Yeah, I mean, I was always interested in the field without knowing that there was actually a field of lifestyle medicine. So I pursued additional training in preventive medicine, and through that became acquainted with lifestyle medicine. But I would say it wasn't until the American College of Lifestyle Medicine annual conference in 2014 that I was truly exposed to the breadth and depth and the amazing momentum of the field of lifestyle medicine.
You found it much earlier than I did. I think I found it in 2019. So, wow, you've been with lifestyle medicine for quite a few years. How do you incorporate it into your practice? I know they're going to read your chapter and find out how it involved you personally, but how do you incorporate it into your practice today?
In my practice today, practicing primarily obesity medicine, I would say obesity medicine and lifestyle medicine go hand in hand because I need to ask people how they're living their life. How are they doing with sleep? How are they doing with exercise? How are they doing with stress? What is their eating like? Social connections. So I do cover all of that with my patients, and we make recommendations and goals together. So I would say it's really the foundation of what I do.
That's so neat. There's so many of the co-authors that are both certified in both obesity and lifestyle medicines. I believe your work is so powerful. I am not in the general field of I do ophthalmology, eyeballs, only. But so what you're doing and attacking it from kind of the root cause with both is so wonderful.
Thank you.
I know you can't share patient stories or anything else, but what is your number one tip for self-care or someone who wants to get involved with lifestyle medicine?
I would say, for anyone who wants to get involved with it, take it one small step at a time. I found it a little daunting at first that I had to be perfect and, had to overhaul everything in my life all at once, which for me was not the case. And I found if I could make one small change and reap the rewards of that, then I could use that to feel better and then add another healthy habit on top of that. So I started with my sleep, which was not good. And I worked on that and set some goals for myself for several months. And once that was in better shape, I was able to add additional healthy habits. And that's what I work on with my patients currently, is helping them set up specific and achievable goals for themselves to start heading in that healthy direction.
I love the small step approach. That reminds me of a book that I listened to on audio that talked about a dad and a son. I don't won't say the specific book, but I know which one it was. But the dad teaching the son a lesson, like build, making a brick wall. I forgot exactly what they were making, but one brick at a time, mortar and brick and mortar. And then at the end, they had this huge, beautiful wall, but it took a lot of work, one little brick at a time. So back to your story, you said sleep was an important aspect, and I know in medicine sleep gets disrupted quickly. How are you able to tackle the sleep issue, which is an issue for a lot of people?
I used a sleep tracking device to just get my baseline and see how I was doing overall. And then I made small adjustments to it, and tried different measures of sleep hygiene, making sure that my bedroom was cool, a good temperature and dark, cutting out blue screens for hours before um, bedtime, trying to get natural light first thing in the morning. So just I was my own experiment over months and just tried a bunch of different things.
Very cool. I know in lifestyle medicine, as you know, when we have to do the board exam, we have to submit a case study, and a lot of us did our own case study because we've changed how we're living. Let's switch gears to the book a little bit, How Healers Heal. Thank you for being part of the book. Why do you think doctors, non-doctors, patients should read this book?
Well, I would love for my fellow physicians and other healthcare professionals to read this book to really get acquainted with lifestyle medicine and learn what it's about. I know that many healthcare professionals have still not heard of the field, or if they have heard of it a little bit and not sure what it actually entails. So I think this is a good but personal introduction and has a lot of actionable tips from a wealth of knowledge from many physicians. And for patients, I would recommend reading this book, to also learn more about the field, but learn how to empower themselves to take charge of their own health.
Thank you. I totally agree. Is there anything else you'd like to mention? I know your time is valuable. Thank you for being with us today. Anything else you want to mention? How to connect with you? How to reach out to you?
Yeah, I would love to connect with people, and you can reach out to me on Instagram or LinkedIn or Twitter. They are all listed on the website. And, I'd love to hear feedback or recommendations of how lifestyle medicine has improved or contributed to your own health journey.
Thank you. I love your Instagram, by the way. Great job on that. And
Thank you.
soon. Thank you.
Thank you so much.